I got many requests to do a detailed video on febrile seizures. So that's what we're going to do today. We're going to first talk about febrile seizure facts, then we're going to talk about myths, and then we're going to talk about what not to miss. So here we go. So a normal febrile seizure in a typical child first starts with a fever. Most of these are viral. Fevers release inflammatory cytokines. Those inflammatory cytokines then travel to the brain and they interact with an immature brain. Children's brains, all healthy children's brains, are somewhat imbalanced during the period of brain growth, which is usually highest between 6 months and about 3. And there is a very big imbalance between excitatory and inhibitory pathways, which makes young children's brains just more excitable at baseline. You add to that a genetic predisposition. Febrile seizures do tend to run in families, and it triggers a seizure event that is brief, self-limited, and rapidly resolves, with the child rapidly return to being their normal, happy self. Other facts. Febrile seizures occur in the general population in about 1 in every 20 children, so they're relatively common. The peak years are between 6 months and 3, with the highest incidence at 18 months. They will tend to completely resolve if your child gets them by 5 years old. 1 in 3 who have had a febrile seizure will have a second one within the next 12 to 24 months. Now let's talk about myths. Myth number 1. Febrile seizures indicate a dangerous or damaging disease and cause neurologic dysfunction or trigger epilepsy. That is not true. Typical febrile seizures are transient, they're benign, and they are not associated with any long-term neurologic damage. Myth number 2, that the height of the fever is what triggers febrile seizures. That is not true. Any jump from a normal to an elevated temperature in these set of conditions with a genetic predisposition, with the right brain at the right age, can trigger a febrile seizure. It's not as if febrile seizures don't happen at 101 and then occur at 104. And then third, what not to miss. All children who have a febrile seizure, especially if they've never had one before, should be seen promptly by a experienced pediatric medical provider in a pediatric setting. Ultimately, clinical judgment is what determines the next step. However, the one entity that no one wants to miss is a central nervous system infection. The red flags, or the set of conditions that tend to trigger that investigation, which usually involves a lumbar puncture, are young age, so typically under 12 months, that the seizure is not typical, which means short, self-resolving, and child return to baseline. If it's prolonged, if there are ongoing neurologic symptoms like hemiparalysis or change in behavior or demeanor, or the child looks ill,